Dr. Coles, you've indicated that the elderly are easy targets for over-medication. Could you explain that, please?
Yeah, you know, I think the average Medicare age patient, I read somewhere, takes 6 different drugs or something like that. And it's and most drugs affect the brain.
Okay.
You know, but they're taking stuff for Lipitor and they're Coumadin and they're taking antidepressants and they're taking something for their bowels and
Why are they
heart and
taking
blood pressure.
antidepressants? Is aging depressing?
Well, it can be, certainly, you know, your
Okay.
friends are dying and there's lots of losses and your connections with your kids and grandkids
Okay, so there
you're
are
in
some
Arizona
depressing.
and they're somewhere else. So it's that our culture is separating families, and that's kind of sad for a lot of people. And sometimes, if, you know, a common sequence is go to your doctor for your annual exam, you might be nervous, blood pressure is up. One elevated blood pressure, and now you have a label of hypertension. Whereas what you should do is say, well, let's check about 20 different blood pressures at different times of the day and at home, et cetera, before we make a decision. But it's easy to, just with one elevated reading, which might be just a temporary thing because you're nervous, in the doctor's office, and now you're on a drug. Well, if you get a drug that's like a beta blocker, that can cause depression. You know, Inderal and Toprol cause depression. It's a blocker of dopamine and norepinephrine. Dopamine and norepinephrine are natural antidepressants, and now you're on a drug that lowers it because it's counteracting epinephrine. It blocks epinephrine, and epinephrine raises pulse and blood pressure. So this is a drug that'll lower that, and it does lower your blood pressure. But because dopamine and norepinephrine are antidepressants, now you're blocking that. And so depression is a very common side effect of a drug for blood pressure. Well, so now the person goes in, blood pressure's fine, but now he's complaining of depression. Oh, 2 minutes, here's a prescription for Prozac. And so they take the Prozac, and maybe that helps a little bit for a while, but it probably poops out. But it can cause mania or insomnia. And so then they go back and say, oh, I'm not sleeping very well. Well, here's a prescription for trazodone, and maybe you better take some Valium too. So you can see how counteracting the side effects of the last drug is another way to add another drug. The sad criminal part, in my opinion, is that there is no scientific studies in the animal labs that has ever been tested on 2 drugs, much less 3 or 4. We don't know what the drug-drug interactions are of these at the molecular level of the brain. So there's no safety studies, short-term or long-term, about any combination of 2 drugs. And so these are massive experiments on humans, and we're not even monitoring it. You know, so people are on 6 drugs. We have no idea how safe that is, what's going on in the heart.
And that's common, 6 drugs.
Yeah, common. They're probably, you know, so nursing home patients, we talked about the elderly, they don't have any control over they don't have the wherewithal to say, no, I'm not taking that. They're probably zoned out already, and they just swallow what the nurse gives them. The obedience thing. We respect authority. Elderly people were more likely raised in punitive households, you know, lots of punishment oftentimes, and they learned to obey their elders, you know, or else, you know, they didn't want to get punished, so they were obedient. And they tend to accept what the experts say. Say, oh, my doctor must know what he's saying, what he's doing. And
well, they think they're being taken care of, don't they?
They regard that as treatment. You know, I need treatment for my sadness. So where do they go? They go to a doctor or a psychiatrist that offers them treatment. Well, if the treatment is harmful, the doctor took the Hippocratic Oath, first do no harm. In defense of physicians, you know, we don't know, we are not told by the drug companies who propagandize these drugs on us, that we don't know the whole picture. We just sort of believe that authority figure. The doctors are obedient to the drug companies, and the patients are obedient to the doctors. So the patients are being obedient to these unknown, nebulous corporations that want them to take the medication.
So the cycle is the elderly get on medications for physical problems, perhaps something like high blood pressure, and then that leads to depression, and then that leads to antidepressants and an assortment of other drugs. And how does it affect things like short-term memory and, you know?
that adversely affects it for sure. You know, it's affecting the brain. Might, you know, if you're on a psychostimulant drug, it maybe enhances memory, you're alert and that sort of thing, but maybe also not sleeping as well. So then you got sleep deprivation coming in there too, and then that gets treated with something else. That's just one scenario. You know, there's all sorts of other scenarios. What happens if someone gets on a diabetes or a blood sugar lowering medication? Those haven't been tested on the effect on the brain, but they're small molecules and they certainly get into the brain. Lipitor, you know, that's hugely popular and the best-selling, most profitable drug for Pfizer that there ever was, I guess. But that causes amnesia in some cases. It causes depression in some cases, et cetera. It has a lot of side effects, but the drug industry is not obligated to figure out what it does to the brain. They figure out what it does in the liver. They know a lot of what Lipitor does to the liver, but they don't study what effect it has on the brain, and yet it gets into the brain. So when there's huge lists of side effects in the physician's desk reference, the PDR, but they never explain why does it cause nausea. You know, they might understand why Prozac helps with depression short term and theoretically why it works. But all this nausea and this sexual dysfunction that are so common, they don't have to explain why it does that. You know, there's no even theory as to why it does that. It's just a side effect. But it's having some effect on other cells in the body, other organ systems in the body. And they are not required by the Food and Drug Administration to explain the side effects. It's scary.
It is. Thanks so much.
Yeah, you're welcome. Yeah.